Right now you have 2 bites because I would guess, money, that your crowns at the back and your veneers at the front were either done at 2 different times or by 2 different dentists, or maybe both. When you have two bites, then your bite moves forward and backward, and that's one of the reasons why your veneers can chip or anything can break.
Okay. Relax and bite.
Bite down.
Relax. Yeah, see, that's her comfortable bite.
Open. Relax, 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 relax your jaw. Relax, and now slowly bite down. Bite, 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 bite. Rib cage.
Overbite.
No, just you have 2 bites. Normal bite. Yeah, that's the patient's normal bite, in which we consider the bite is closed. That's what we call habitual bite or MIP bite for the patient. That's where she functions. But open. Relax, relax, relax a little bit. Relax, relax, and slowly bite down for me. And that's what we call centric relation, or the patient's joint position, in which we can see the patient's teeth and the patient's joint have 2 different positions. That's not a big deal in most of the patients, but when we're gonna restore the patient's whole mouth, or at least 1 arch, as in her case that we're gonna do all the top, we wanna make sure that we record this bite, because that's the patient's joint position. It's the most comfortable position for this patient, and that's the position where the veneers and the crowns are gonna last longer. Because when the patient in her other position, the patient, without noticing, she's gonna move from this position, open, bite down, to her normal position. So now she's noticing because I'm guiding her, but in her normal day-to-day life, she's gonna slide from this position, open, relax, 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 bite down. And now, without opening, can you slide your teeth to the front? Slide, slide, slide. Yeah, so that's normally bite down. That's normally what patients do. They slide from their joint position to their MIP or teeth position, and that can cause fracture of the veneers or the crowns, and maybe that's why this veneer broke here. To let us do this, bite down. Forward again. Okay, 1 more backwards. Now forward. Perfect. I'm just gonna touch your back teeth so that I can give you 1 stable bite. We're still like not in the perfect position, but we're lucky in this patient as we have to change the crowns at the back. So what we're gonna do first, we're just gonna change the crowns at the back, and by changing the crowns at the back, we're gonna be able to get to the perfect bite, and then we're gonna do the veneers. Your bite is gonna be guided by your front teeth, and you're just gonna have like 1 bite. Once I take out your crowns at the back, only your front teeth are gonna be guiding, so you're only gonna have 1 bite. Then I'm gonna take your bite at the right position, and then we're gonna design your crowns at the back.